handrails up, make sure you're not pinching anything, right? Pad things, because you don't wanna cause them any injuries. And make sure you don't put them on anything that they exceed the weight limit. Because if you put a 750-pound patient on a stretcher that's only rated for 700 pounds, guess whose fault that is when that collapses? Yours. Okay. All right. So, this is important. Pregnant people, greater than 6 months pregnant, the baby will sit on their vena cava and cause hypotension. You have to tilt them, okay? So you have to put some padding under their right hip and tilt them to the left, so that baby is not causing hypotension, okay? It's easy to forget to do, but all of a sudden you're gonna be like, why is my patient so hypotensive, okay? Make sure they are tilted to the left, so that baby is not sitting on their vena cava, so they can get blood return to their heart.
Probably won't be able to breathe, so I'll probably tell you to see it, because that's not a fun feeling.
Yeah, I imagine that. So here's a picture of our humpback folks, better known as kyphosis, and you might have to put some padding underneath there, okay? You may have to, what Kevin was talking about before, you may have to use a blanket roll or towels to, help keep their spine in line. And yeah, a vacuum mattress is preferred, but we don't ever have that. Okay. There are certain conditions, like this is all talking about, that was talking about the geriatric patients. Kids, they have big heads, right? So you pad underneath the shoulders to keep them in line. And they treat with the right seat collar on. All right. Yes, we don't want to use backwards for 30 minutes or really at all if we can avoid it. We already talked about that. I wouldn't give anybody norepi with a spinal cord injury. I would call medical control and ask them what they want you to do. Okay. You're going to give the fluid, but I mean, we don't have any other pressors, but I would call med control and say, hey, here's our patient, this is the situation, what do you want me to do? Okay, don't put it on you. Let them tell you what to do. Alright, so now if you have a head trauma patient and they're tachycardic and hypotensive, they probably are bleeding somewhere. Okay? So you gotta find where else they might be injured. Alright? We have pain medicine, use it. Okay? Manage the hypothermia and bring them to the right level trauma center. People do not need to be in pain. We have good meds to fix it, okay? Would you want your husband, wife, kid, grandpa be in pain? No. And there are some injuries you look at and you're like, oh yeah, I'm giving you meds, right? We have a bunch of different things that we can use to help people make them more comfortable. There are patients that I have not been able to move until I have medicated them because they're in so much pain, okay? It usually involves shoulder injuries, okay? But, because they're extremely painful. But you may have to do that, okay? But think about it, if you were in their place, would you want pain meds? Yes, okay? All right, so, yeah, we went to the hospital. So we went to the level of trauma center. She underwent surgical intervention for a cervical spine fracture, and she was lucky that she didn't have, she had no irreversible cord damage, so she's very lucky. And she was released to rehab. So, all right. Yep. Okay. Questions? Yes.
Because I know for the regular neurogenic shock for like head injuries, you said you may have to get vasopressors. Oh, just to finish the question, just like I know for high spinal cord injuries you don't. Is there any like way to tell if it's mimicking the other, or would you just precautionarily not use a vasopressor?
I wouldn't use it until I talk to a doctor.
Okay. So whether it's neurogenic from head injury or
right.
spinal, just call it out.
Yeah, because we don't have the luxury of imaging, for one. And the only thing we can really do is give them fluid. and get them there. So, you know, call the doc and let them make that call. That's what they go to 4 years of school for, and 3 years of residency, right? All right.
And also for that one patient, their BP was like 80 to 150. So you do a quick calculation on that, your map is already above 60. So there's gonna be situation dependent, you know, this is like someone neurogenic shock, like mid-spine and below is flushed. And also, going back to the C-counters, let's just say, inform the patient, hey, listen, you got neck pain, minor MPA. They don't want it. What's something else?
There's nothing like that. That's
Yeah.
not
No
it.
refusal of intervention.
Yeah.
You cannot be too careful. Your documentation will save you or crucify you.
That's what I meant.
100%. Because more often than not, you can ask Kelly, Scott, anybody, a lot of times when medics get hung up in the court, it's not the crazy, oh shit, MCI calls. You know what it is? It's the bullshit fender bender in a parking lot
Yep.
with 0 damage to the car. But they said, I have connected back pain. Files are perfect, they're out, they're on the phone with insurance, this is horseshit, I don't give a fuck. Well, guess what? 3 years later, when you get subpoenaed, and if you get called in, why didn't you place my client who has crippling, debilitating spinal pain and quality of life and mobility issues that all stemmed from this incident, is what they say. Then what do? You are up the creek without a paddle. You cannot be too careful.
Yep, and I will say this again, I know I've said it before, get your own insurance. It is not expensive, it's $110 for your first year as a medic, okay? Because the company you work for will be defending themselves, not you, okay? So get your own insurance. All right, let's take a 10-minute break, come back at 7:15, and then we will start our.